Hello everyone, my name is Yvonne Odhiambo and I'll be taking you through our chosen problem statement and what our project is all about. This project it's courtesy of Yvonne Odhiambo, myself, Frida Karaoke, Faith Wamboi, and Claire Omolo. Our chosen problem statement was inaccessibility of mental health services in rural areas. You might wonder why we chose that. Well, when it comes to mental health shapes how we think, how we feel, how we act, and it influences the choices that we make, how we handle stress, and also the quality of our relationships. And I believe this is very major. Yet, millions of Kenyans, especially those ones living in rural areas, to them, mental health support is something they hear about but rarely are able to access. So Kenya lacks adequate mental health services due to workforce issues and financing gaps as well, disproportionately affecting rural areas mostly and low income populations as well. Or how big is the problem? In a nutshell, we could say that because rural areas lack specialists, they lack funding and structured services, many people with mental health issues go untreated, leading to worsening of conditions and higher suicidal risks. This gap in access continues to cost lives and deepen the silent crisis in rural communities. As a result, rural residents carry a heavy burden in silence, with preventable suffering becoming part of their normal lives. You might wonder why this matters. A census done in 2024 shows that 68% of Kenya's population lives in rural areas. Yet, most of these people have no access to mental health services, as only 13% of healthcare facilities have these resources. That is very low. This eventually leads to untreated mental health illnesses, reduced productivity among people, and preventable deaths, perpetuating poverty and inequality. What really happens, you might wonder. So picture a situation whereby someone is really living in a rural area and they start to struggle with an issue like depression. And then the nearest therapist or trained personnel lives hours away. So that means they have to calculate the cost of transport, the stigma that comes with that, and also the fact that they might lack a proper support system as a result of the stigma. So mostly you might find that this person might decide to suffer in silence and not seek support that they need. And now when it becomes a demanding issue, the condition has already exceeded or has become chronic and might need more support or might need more treatment than was earlier expected, which could have been prevented if only these services were available and accessible. So the chart below shows an upward trajectory from 2017 to 2024 in terms of suicide deaths over the years, and the numbers increased continuously from 365 to 620 annually. This shows that it's becoming a concerning issue. The rates per 100,000 people has also climbed steadily. These upward trends highlight the growing public health crisis, one that cannot be ignored. The graph below shows that the top reason or barrier to access to mental health services is the cost of therapy at 81%. However, the other barriers also pose a strong threat to accessing of mental health services, with things like shortage of therapists at 72%, geographical access at 68%, stigma at 62%, 65% rather, and limited resources at 55%. So even when people want help or want to seek help, services are simply not available or reachable, as you can see from this graph.
Hi, allow me introduce you to Amara. Amara is a 33 years old female, small-scale farmer, mother, and occasional laborer. Her educational level is vocational training. She is divorced, lives in Mwingi, and her monthly income is 20,000 Kenyan shillings. She has 2 children of varying ages, and her interests include reading, cooking, and listening to gospel music. This is Amara's story. As a woman from rural Mwingi, Amara's life is a repeated pattern that involves juggling farming, childcare, and household duties alone, while her ex-husband works in a different town. She's experiencing depressive moods and anxiety from economic hardships and family stress and loss. However, she lacks medical knowledge of what her situation is, as it is still undiagnosed. She cannot also seek mental health support and treatment, as there is no known mental health wing in the local general hospital. Her pain points include limited access to mental health care and her undiagnosed condition. There is a solution to this, a mental health app with a chatbot that will connect all the users to services such as counseling sessions, as well as a connection to a therapist. Welcome to our WellCare app, a solution to Amara's problem. This app enables Amara or the user to log in their details or sign up if they do not have an account to be able to receive these incredible services. If you're signed in already, you are able to fill in your profile and move on into telling us how your mood is. Are you feeling happy? You're able to do that. If you're excited, you're able to do that. If you're sad, low, these emojis are able to help you know how you're feeling at the moment. You thereafter check how you're feeling. If you're having symptoms of depression, you can get to check your self-esteem as well as know whether or not you have a growth mindset. We look forward to a future where we'll get to partner with service providers for an SSD option within the app, because this will help reach users without internet connection. And this is a plus for those people living in rural areas where internet accessibility may be a challenge. In conclusion, mental health care in rural areas remain deeply inaccessible, leaving people like Amara with undiagnosed conditions and support. The rising numbers of mental health related deaths and overwhelming barriers to care show a crisis that can no longer be ignored. Our solution, the WellCare app with a chatbot, counseling access, and connection to a therapist, takes a crucial step towards closing this gap. By bringing accessible and affordable support directly to undeserved communities, we move closer to a future where no one is left behind. Thank you.